Hello friends, I'm Dr. Himanshu Tyagi, Orthopedic Surgeon in Delhi. Today let's talk about avascular necrosis of the hip, more commonly known as AVN. Let's understand what it is, why it happens, how it presents, and how we diagnose it. So let's start with what is avascular necrosis AVN. Avascular necrosis means death of bone tissue due to lack of blood supply. When AVN affects the hip joint, it damages the upper part of the thigh bone called the femoral head, which fits into the hip socket. Without proper blood flow, the bone becomes weak, may collapse, and eventually cause arthritis. Next important question is, why does it happen or what causes it? AVN can happen due to various reasons. Some of the common causes include conditions like use of steroid, especially long-term or high-dose steroid medications. Secondly, alcohol abuse. Excessive alcohol affects blood flow to bones and can cause AVN hip. Third reason is trauma or injury to hip like fracture or dislocation. Fourth, blood disorders like sickle cell disease or blood coagulation disorders. Fifth reason could be conditions like autoimmune diseases like lupus. Sixth most important reason could be in post-cancer states like radiation or chemotherapy. And finally, sometimes there is no reason. This is called as idiopathic condition. Now let's talk about the affected age group. AVN mostly affects people between 20 to 50 years of age. Now let's see the symptoms of AVN of hip. The early stages of AVN may not cause any symptoms, but as the disease progresses, you may notice symptoms like pain in the groin or front of the hip. This may progress to frank pain, increasing on walking or standing. Later, it can progress to a limp while walking. Slowly, the patient may complain of stiffness or reduced range of motion of the hip. Ultimately, it can lead to difficulty in sitting cross-legged or climbing stairs. Pain may initially come and go, but over time it becomes constant, even at rest or during sleep. So now the next important question is that how do we diagnose AVN? Normally, a MRI can pick up the disease in the early stages. However, in later stages, even an X-ray can pick it up. Also, sometimes a CT scan is required to evaluate bone collapse or planning surgery. Please remember that clinical examination is very important at every stage for correlating the radiological stage with the pain, walking pattern, and hip movement of the patient. Radiologically, we usually grade AVN into stages 1 to 4. This is based on how much bone damage has occurred on MRI and X-ray. In early stages, stage 1 or 2, AVN can be managed with medicines, lifestyle changes, and procedures like decompression. But once the bone collapses, stage 3 or 4, joint preserving treatment is less effective and the patient may require like hip replacement surgery. That's why it's important to catch AVN hip early. So please remember that avascular necrosis or AVN is bone death due to poor blood supply of hip joint. Most common reasons include steroids use, alcohol consumption, trauma, or sometimes no reason. Early symptoms include groin pain, limp, and stiffness. The key in AVN hip replacement treatment is to catch it early to prevent joint damage. If you have hip pain that's not improving, especially with a history of steroid use or alcohol, don't ignore it. Get it checked early by your doctor. Thanks for watching. For any further queries or consultation, feel free to contact us on +9 196 540 95717. We are in Delhi, India. All the best.